Mrs. Yang is 30 years old, married, without children, lives with her husband and her mother-in-law. On May 4th, she was diagnosed with tuberculosis and taken to the negative pressure isolation wards. After taking the medicine for 2 weeks, the results showed AFB negative. After further evaluation, the doctor agreed for discharge, changing to the outpatient follow-up treatment, and asked the nursing staff to assist with tuberculosis, home care, and diet hygiene.
Coming.
Hi, my name is Alex Tanner. I'm the nurse who will be taking care of you today. May I check your wristband?
Okay.
Okay, so what is your name?
Yan Lily.
And when is your birthday?
January 1, 1990.
Okay, so Mrs. Yang, you will be discharged from the hospital in 2 days. I am here to teach you how to take care of yourself when you go home, and how to select your choices of meals to take better care of yourself.
Oh, I'm finally going to be discharged from the hospital. I still have a chance to spirit each others because I'm scared of infecting my family.
Well, do not worry. The health education I'm about to tell you will let you know how to pay attention to avoid it.
That's good. Tell me, I will listen carefully.
Okay. So, in general, the tuberculosis medications must be taken for at least 6 months. You can look at it here. You cannot stop your medications by yourself. Okay? So, and part of the side effects while using it are blurry vision, itchy skin, upset stomach, nausea and vomiting, dizziness, poor appetite, etc. If they happen, please immediately seek medical attention.
Okay.
Okay, so then please remember to follow up regularly and try to avoid taking Chinese medicine or other medications while using it to prevent the efficiency of the medication.
Okay, can I drink and smoke during this period in the hospital? I have endured for a long time.
Well, it's better not to, because drinking will cause serious damage to your liver, over here, and smoking will irritate your trachea, causing coughing and affect the treatment.
Oh, okay, I understand. I will try my best to do it.
Okay. All right. Then I'm going to teach you about how to protect yourself and your family after returning home.
Yes, I will listen it carefully.
Okay, for the environment, I hope that the house can be kept ventilated and dry. Your quilts and clothes are best taken out for sunbathing. The sun's radiation can kill bacteria. For tableware though, do not use and wash them with your family. Wash them by your hands, by yourself, by using the boiling disinfection method. The heat can kill bacteria.
No problem. My home is very ventilated and my home is full of sunshine. But what is a boiling disinfection method?
Okay, so the boiling disinfection method is to place the tableware in a container and boil them with 80 to 95 degrees Celsius water for 10 to 15 minutes.
Oh, it's so simple.
You okay? Here. Are you all right, Mrs. Yang? You okay?
Okay.
Are you sure?
Okay.
Okay. Then, okay, so let's, and if you cough, like what you did just now, You must cover your mouth and nose and with tissue like you did before. The spit is wrapped in and thrown into a lidded trash can or immediately into the toilet to flush. And wash your hands immediately after.
So,
You can use this.
okay. Oh, so the thing needs to have a lid. Then I will going to go home and check it. I will buy them if there isn't any.
Very good. You are really positive. When you go out, it is best to wear a surgical mask so that you can protect yourself and others.
Oh, I will do this after leaving the hospital.
It's good. Mrs. Yang, have you done any exercise before?
Yes, but I haven't do exercise in a long period of time. I want to go out and move.
Oh, that's good. Doing exercise helps to stabilize your condition, but if you experience discomfort during it, remember to take a break.
Okay.
Now we are going to talk about how to maintain a balanced diet.
Do I have to do it? I have no appetite recently.
Well, yes, you have to eat it. It can help your recovery and provide you with the nutrition you need to fight the disease.
Okay, what can I eat?
Well, look here. You can eat more protein, minerals, especially iron and vitamin C. If you feel you have no appetite, you can take a small amount of meals, but eat frequently.
Okay, by protein, you mean like eggs, soy milk, or other similar food?
Correct. Eat less deep-fried food to reduce the burden on the liver.
Okay, luckily I don't eat deep fried things.
That's really good. Eating too much fried food can burden the body. Okay, so any other questions, Mrs. Yang?
Yes, because I've heard tuberculosis is a contagious disease. So I wanted to ask which kind of people can easily get it.
Well, generally, if the body's immune system is low, no matter the age, gender, anyone can get it.
My husband and I have plans to have children. Will I discharge? Can we have baby?
Oh.
Will I transfer this disease?
I understand. You're worrying about if you will transfer this disease to your husband, right?
Yes.
Okay. Well, patients who are not in isolation can have sex normally because tuberculosis is spread by droplets. If you don't get in contact with the secretions from the respiratory tract, it usually doesn't spread. But I would suggest you to take your medications for the whole 6 months. Afterwards, come back to follow up in the outpatient department. And if everything's clear, you can then have sex life normally.
I understand. I will do whole treatment. With otherwise infecting him, it won't be good.
I understand. You worry about infecting him.
Yes.
Do you need a hug?
No, thank you. Oh, and can tuberculosis be passed on? I'm afraid that my children may catch it.
Well, tuberculosis can't be passed on. You can relax.
Oh, I'm relieved. I want my children to be healthy.
Understandable. Do you have any other questions?
No more. Thank you.
Then it's time for me to ask you questions. Let's see how much you remember.
Okay.
Okay, so what's the temperature and time for the boiling disinfection method?
In a container, boil them with 80 to 95 degrees Celsius water
Yes.
for 10 to
15.
10 to 15 minutes.
Yes. In a container and boil them with 80 to 95 degrees Celsius water for 10 to 15 minutes.
Okay.
Remember that.
Okay.
And the medicines, if you don't want them anymore, can you stop the intake on your own?
No, you have to do it as the instruction says.
Yes. And for the last question, when you leave the hospital, what meals can you take daily?
I'll eat more protein.
Yes, and?
Iron
Yes.
and vitamin B,
Not vitamin B.
vitamin C.
Yes, you had them all correct except the last one. It's protein, iron, and vitamin
C.
Yes, C. I have to remind you though, if you cough blood or have chest pain of any kind, please check in because it might be because of the disease resurfacing.
Okay, I will pay attention.
Good. Then Mrs. Yang, rest well, take care. I will go back to the nursing station first, and if you are in need of assistance, you can call me by the red bell at the head of the bed.
Okay.
Good luck.
Okay.